Shigella, genus of an enteric, rod-shaped bacteria in the family Enterobacteriaceae, which are normal inhabitants of human intestinal tract and can cause dysentery or shigellosis. Shigella are gram-negative, non-spore-forming, and non-motile bacteria. Their cellular diameter ranges from 0.4 to 0.6 micrometers, and a single bacteria can grow from 1 to 3 micrometers in length. The Shigella species are transmitted by the fecal-oral route, and most infections are transmitted from person to person, reflecting the low infectious dose. The risk of transmission and infection increases with poor hygiene and sanitation, ingestion of contaminated food or water, overcrowding, and sexual contact. As few as 10 Shigella bacteria can result in a clinical infection, and almost up to 80% of all infection is the result of a person-to-person transmission. They are present in the stools of infected people while sick. Because of its manner of transmission, shigellosis has long been associated with outbreaks in daycare centers, nursing homes, institutions, prisons, and cruise ships. People with diarrhea caused by Shigella sonnei recover completely, but it takes several months before their bowel movement come back to normal. With Shigella FLEXNERI, about 2% of people who are infected develop joint pains, irritation of the eyes, and painful urination, which are typically diagnosed as Reiter syndrome or reactive arthritis, a complication that accompanies other kinds of bacterial infections which can last for months or even years and may be difficult to treat. The Shigella multiply in the intestinal tract and invade the cells, causing tissue destruction. Many strains produce toxin called the Shiga toxin, which are very potent and destructive. Complications of shigellosis include severe dehydration, seizures in kids, rectal bleeding, invasion of bacteria in the bloodstream, and proctitis or rectal prolapse. Shigellosis is diagnosed through testing of stool sample from an infected person. It is placed on a medium to encourage bacterial growth. If there is growth, the bacteria are identified, usually under the microscope. Special tests such as antibiotic sensitivity test can be conducted because Shigella is often resistant to multiple antibiotics. Antibiotics can shorten the course of shigellosis and might be life-saving. Commonly used antibiotics are ampicillin, trimethoprim sulfamethoxazole, or ceftriaxone. Ciprofloxacin is also commonly used to treat infected adults. Unfortunately, Shigella developed resistance to ampicillin and trimethoprim sulfamethoxazole and replaced with quinolone or cefixime. Vaccine for Shigella infection has yet to be perfected. Thus, the best approach in the meantime is the prevention of the infection, such as frequent and careful hand washing with soap and hot water, basic food safety precautions, disinfection of drinking water, and eat cooked hot food or fruits that you peel yourself. For more information about Shigella and shigellosis, check out these sites.